I'm going to say this like as clearly as I can without the medical lingo. So the COVID vaccines are safe and effective. And even though they aren't quite as effective right now against the Delta variant as they were against the earlier strains, they are still effective and they're still doing their job. They're still reducing the likelihood that you'll get sick enough that you have to go to the hospital, and certainly really reducing that risk that you'll die from COVID. So with regard to vaccines in general, they're safe. They do not cause autism. They don't cause other long-term disabilities. Obviously, there are some side effects, rare complications, but the same thing could be said about water. So for those of you who are still concerned that the vaccine was developed too quickly, may I ask you a question? What is your criteria or your standard by which time a vaccine or medicine should be determined to be safe and effective? So I've had a lot of conversations, obviously, with people, and I think people have been surprised to learn that time in and of itself isn't typically a formal criterion measure by which to evaluate the safety and effectiveness of vaccines or medicines. So the primary criteria actually are how common the disease is, how much benefit people get from the vaccine or the medicine, and then how many people participate in the study. And so with regard to COVID, we actually had quite a few things happen. Number one, COVID was and is very common. Number two, the benefit we observed from that vaccine was very large. And then we had tens of thousands of people volunteering to participate in those studies, lots of people in a very quick time. So those three factors combined to helping us evaluate and determine that the vaccine was safe and effective. Of course, there's other things we could talk about, but as far as just that clinical piece, hopefully that helps just make it a little more clear about why some of that happened quickly.